You know, one of the things that we've always done with the Education and Training Committee is that we try to create seminars where you'll get an overview of a particular topic. But then what we really like to do is provide a forum for all the attendees to talk about, okay, I got this, but my business is this, you know, your particular situation. You have 3 panelists up here who are experts. I'd like to turn it over a bit to the audience where if you're thinking of questions that are nagging you about your particular business, how you're gonna, something you gotta do right now, you know, in preparation for next year's tax return, something that you should be doing in 2011 so that that year is okay, the following tax return. Any of those questions that you have right now, this is your opportunity to put them out. I did put those cards on your table. So far I got 2. I'll just read a couple, all right? And then if any other questions, please. 1, if an employee works 5 hours per week, are they subject to penalty if not covered?
There's not necessarily a penalty. I think what a lot of it has to do with New York State law says in order to be eligible for health insurance, the minimum number of hours an employee could be considered full-time is 20 hours. So that's number 1. But number 2, typically what you want to do is you want to take a look to see what the specific employer requirements are. The employer might say, well, listen, you know what, in order to be considered full-time here, you have to work 32 hours. So it really depends upon the type of employer, you know, and what they want to do.
But would that employer then have to provide? No.
Okay.
No. They might take the penalty.
They might
The
take the
penalty
penalty.
would be so low if they only have a few employees like that.
That's exactly right.
Okay, I'm getting it.
But depending upon the employer and who they might say, listen, you know what? For part-timers, 20 hours, between 20 hours and 32 hours, we'll let them come on our plan, but they're going to pay 100% of the premium. Because what's going to happen here is, I don't know if anybody has an individual plan. New York State offers mandated individual plans, and if anybody has taken a look at these premiums, as Todd had mentioned earlier, these premiums are over $1,000 right now. They're close to $1,500. They're absurd.
Right. The second question, I'm not too sure, you might have to elaborate, whoever gave me this here, but what is the proposal for eligibility requirements for healthcare? That's pretty broad, I think. You wanna
Right,
elaborate on that?
I had asked that question.
Yeah.
I was at another seminar where, with this healthcare reform, I was hearing that, and this is going with the penalties, government penalties, that a employee would be eligible for insurance if they average 20 hours or more in a 5-week period. Now, if that's the case, and we do not offer insurance, we're hit with the penalties for employees. Is that correct?
Well, I'm not sure I agree with your premise, because at least for large groups, full-time employees is determined as 30 hours a week, as far as what's in the regulations. So this 5 weeks over, 5 hours a week over 5 weeks, I'm not familiar with that. Todd, have you heard anything on that?
I'm not familiar with that either.
I only know of 30 hours that I've seen also
Yeah.
is what constitutes a full-time employee for this purpose.
Isn't there something on the time frame, because you have seasonal workers like in a retail operation, where they're raised to 40 hours a week for a period of time, and they're still considered part-time, not available for healthcare. But in my old company, it used to be 16 weeks. If you worked 16 average, so you could work 14 and then cut it back. But if you worked 16 weeks at over 30 hours at the time, you were automatically vested as a full-timer. And it would make sense for healthcare with seasonal workers if you were working 40 hours a week for the summer for a kid. They're not going to be a full-time worker and then go back to part-time for the rest of the year. It's got to affect the summer.
Yeah, seasonal workers are excluded from calculating.
So what's the seasonal worker?
It's 120 days or less for the year of working 100, so which is
Okay.
16 weeks.
Right. That makes sense.
If I did my math right.
Okay, sounds good. But that also means you could still be employed as a part-time.
Right.
Local college student goes to work full-time for the summer, 14 weeks, 16 weeks, and then cuts back to 15 hours.
They could conceivably be working 45 weeks a year. And
Yeah, so
10 of those weeks are full-time.
Yeah, so as Arnie was describing, when you have to divide it by the 20/80, so those, if someone falls outside the scope of a seasonal, then they're considered part-time. And if you have two part-timers working 50% each, they're considered one full-timer, to simplify it.
And most of this stuff is done on a monthly basis, not on an
Days
annual
at 8
basis.
hours a day?
These penalties
Average,
and things
is
like
that what
that.
they do? Because what if they don't work? You know, is it 120 days, if they work for 2 hours, is that considered a day of work? Or is it 120 days and 8 hours of work?
Wasn't that on page 1,652?
Just see if we can figure it out.
Do you really have that
Just a
situation?
balance.
Do you really have that situation, or are you just wondering?
I'm wondering. But I mean, that is a situation, especially in retail, that is definitely a big situation.
I don't know the answer to that, John, Arnie?
I haven't gone, I mean, there may be an answer I'm sure there is an answer somewhere buried
Just
somewhere where it
wondering.
refers to some other employment regulation. But I don't know the answer off the top of my head, how you would do it in those sets of circumstances.
Jim, I put a slide up here, something to keep in mind. The penalty for not offering health insurance, if you're a business that does not offer health insurance, it does not automatically mean you're assessed a penalty. And number one, you have to have at least one full-time employee enroll in health insurance in the exchange, which is available in 2014. And also that individual has to qualify for a premium tax credit. And remember, the tax credit's based on household income. So if you're an employer that does not offer health insurance, and again, you have to be a larger employer, greater than 50 employees anyhow. If you're that employer, you do not offer health insurance, and an employee applies for insurance in the exchange, and that individual qualifies for a tax credit in the exchange, then the penalties kick in. But only then. If there's no tax credit for that individual, there's no penalty for the employer.
And not qualifying would really be based on the hours then? That's the only limitation? So you're saying if they have to be qualified, if they participate in the state exchange program, and they have to be qualified to receive benefits?
They have to qualify based on household income for a premium tax credit. Otherwise, an individual can still purchase the insurance in the exchange, and they're just going to pay the full retail price, so to speak, without any credit.
You have to now click employees' tax insurance check?
You will know your response.
You may, I don't know if you have to, I mean, you're gonna know. Well, I think that the exchanges, or that are going to provide that information. I think the premium credit qualification, as well as, has to go through the state exchange, I think is what it is. And they determine whether an individual qualifies for the credit, whether they're whatever percentage above or at the poverty level. And once they make that determination, I gather, I don't know the notification procedures, but I gather the employers are notified in some way, shape, or form that this employee qualifies for the credit and is buying the insurance through this exchange. So the information is going to come from the exchange. How they're going to do it, I'm not sure.
Question for you, Arnie. I think really a two-part question. In reference to the Cadillac Tax, you have a situation where the employer contributes and the employee contributes. Is that just if the employer contribution is greater than the $27,000, whatever it is, or is it the total premium?
I believe it's a total premium.
And is there an index for inflation? So if average costs are going up 15 to 20% per year on healthcare
I
plans,
believe that provision is indexed for inflation. I'm not 100%.
but not at 15 to 20%, but the rates are going up. It's going to be based on the CPI.
These thresholds may be increased to reflect higher than expected inflation in health premiums. I have to look closer, but I gather there's a mechanism. It's not mandatory, but there's a mechanism if inflation goes up by a certain percentage, that these thresholds would be then increased for inflation. There's no set inflation index here?
I'll tell you one thing though, I guarantee whatever that inflation rate is not gonna be near the premium increases.
So in the New York metro area, pretty much anybody that's on a PPO or PPOS plan
Absolutely.
is going to be subject to the Cadillac tax.
Absolutely.
So some 60% of
Yeah,
people.
absolutely.
And keep in mind that tax is not assessed on us as the consumer. It's assessed on the issuer of the insurance company. So if the insurance company is selling your business a Cadillac plan where the total premium, and it's whatever the employee and employer pay combined, exceeds that threshold, then there's a tax. It's a 40% tax on the excess premium over that threshold. It's taxed to Oxford.
Okay.
And we know what Oxford's not going to just pay that tax. So indirectly, you're paying
They're
it.
gonna
But
build
it's,
it in.
they're going to build it in, which goes back to the HSA and the whole idea of these lowering your premium. That's another area where the premiums are just going to dictate. You're just not going to have that type of plan.
Where it might make sense to switch to the HSA and a high deductible plan.